Today, we are going to talk about blastomycosis versus histoplasmosis in veterinary medicine. Both are systemic diseases caused by dimorphic fungi that grow as molds in the environment but convert to yeast inside the host. Infection follows inhalation of spores from contaminated soil, and direct spread is not expected. The main difference is how each organism behaves after entering the body and which organs it most commonly damages. Blastomycosis is caused by Blastomyces species and is diagnosed far more often in dogs than cats. Exposure is associated with moist soil, decaying vegetation, and waterways. Histoplasmosis is caused by Histoplasma capsulatum and is linked to soil enriched by bird or bat droppings around the Ohio and Mississippi River valleys. After Blastomyces spores enter the lungs, they become large, thick-walled yeast cells and create pyogranulomatous inflammation. The organism may then spread through the bloodstream to the skin, eyes, bones, and nervous system. On cytology, Blastomyces appears as a large yeast with a thick double-contoured wall and a daughter cell attached by a broad base. Histoplasma behaves differently. Its tiny yeast cells survive and multiply inside macrophages, which distribute the organism to the liver, spleen, lymph nodes, bone marrow, gastrointestinal tract, eyes, and nervous system. On cytology, histoplasma appears as very small, narrow-based budding yeast clustered inside macrophages. Blastomycosis should move higher on the differential list when a dog has respiratory disease together with skin, eye, or bone lesions. Pulmonary disease may cause coughing, rapid breathing, fever, weight loss, or hypoxemia. Skin involvement often produces nodules, ulcers, or draining tracts. Ocular spread may cause uveitis, retinal detachment, glaucoma, or blindness. Fungal osteomyelitis can cause focal lameness and destructive bone lesions that resemble cancer. Cats can develop similar disease, but feline blastomycosis is uncommon. Histoplasmosis more often causes chronic illness. Dogs commonly develop gastrointestinal disease with weight loss, diarrhea, blood or mucus in the feces, protein loss, enlarged abdominal organs, or ascites. Cats often show respiratory distress, skin lesions, enlarged lymph nodes, or ocular disease. Either species may develop fever, pale mucous membranes, chorioretinitis, meningitis, or widespread organ involvement. Thoracic radiographs in blastomycosis often show diffuse nodular interstitial or peribronchial disease, pulmonary nodules, consolidation, and enlarged thoracic lymph nodes. Histoplasmosis may produce similar patterns, so radiographs alone cannot reliably separate the infections. Abdominal imaging in histoplasmosis may reveal enlarged lymph nodes, intestinal wall thickening, hepatosplenomegaly, or effusion. Diagnosis is strongest when the organism is demonstrated directly. Large, broad-based budding yeast and aspirates from skin, lymph nodes, bone, or lung supports blastomycosis. Tiny intracellular yeast inside macrophages in lymph node, liver, spleen, bone marrow, or intestinal samples supports histoplasmosis. Histopathology with fungal stains is useful when cytology is inconclusive. If culture is attempted, the laboratory must be warned because the mold form can generate infectious spores. Urine antigen testing is sensitive for both diseases, but Blastomyces and Histoplasma antigens cross-react strongly, so a positive result cannot always identify which fungus is present. Results must be interpreted with geography, clinical signs, imaging, and organism appearance. Falling antigen values support improvement, while rising values raise concern for persistence or relapse. Itraconazole is the main oral treatment for both diseases. Blastomycosis is commonly treated at approximately 5 mg per kilogram by mouth every 24 hours for at least 3 months and until active disease has resolved. Disseminated histoplasmosis usually requires at least 6 months of treatment, and sometimes more than 1 year. Exact dosing and duration must be directed by the veterinarian because absorption varies among products and adverse effects can include poor appetite and liver injury. Itraconazole inhibits fungal lanosterol 14-alpha demethylase, reducing production of ergosterol, an essential fungal cell membrane component. This disrupts membrane function and inhibits fungal growth. Fluconazole may be considered when eye or central nervous system penetration is important, although it may be less effective against blastomycosis. Treatment must continue after visible improvement because organisms may remain within affected tissues. Severely ill patients may require amphotericin B with an azole. Amphotericin B binds ergosterol and creates membrane pores that kill fungal cells. Conventional formulations can injure renal tubular cells, so kidney values, electrolytes, hydration, and urine production must be monitored. Lipid-associated formulations are less nephrotoxic. Oxygen, fluids, nutritional support, and management of ocular or neurologic complications may also be necessary. Blastomycosis is strongly associated with fungal pneumonia plus skin, eye, or destructive bone lesions, while histoplasmosis more often causes tiny intracellular yeast with gastrointestinal, lymph node, liver, spleen, or bone marrow involvement. Either fungus can disseminate widely, and antigen tests may cross-react, so cytology or histopathology remains important. There is no routine vaccine for either infection. Risk may be reduced by limiting exposure to moist disturbed soil, decaying vegetation, waterways, caves, chicken coops, and soil contaminated by bird or bat droppings. Complete avoidance is difficult in endemic regions, so early recognition matters. If you have topics you would like us to make content on next, or would like to donate to our video or game development, reach out to @doggersgame or dogtoursgame@gmail.com.